Today I would like to share about glyceryl trinitrate um, from a pharmacological aspect. So I will be sharing about this drug um, and its uses in stable angina. Okay, let's go. So first, let's take a look at its dosage and indication. This drug on the left just now. Assalamualaikum. I hope everyone is doing fine. So today I would like to share about the pharmacology of glyceryl trinitrate from um, Assalamualaikum. Today I would like to share about the pharmacology of glyceryl trinitrate and its use specifically in stable angina. This drug on the left is also known as nitroglycerin. It is a type of nitrate. It comes in various dosage form and is used to treat different diseases. However, because today we're going to talk about stable angina, we will discuss its use in stable angina. Alright, let's go. Let's first take a look at GTN's various dosage forms and indication. Firstly, the sublingual tablet and spray as well as the buccal tablet can be used to relieve acute angina. Um, for the sublingual tablet and spray, they are administered under the tongue. Uh, According to MIMS Malaysia, for the tablet, the dosage form can be between 300 to 600 microgram. For the aerosol spray, each spray delivers 400 microgram of the drug. We will talk about the directions of use later and the maximum dosage as well. Alright, so now, in addition, options for a longer action of GTN includes ointment, oral, and buccal GTN. The ointment can be applied twice or 3 to 4 hourly. On the other hand, for the oral GTN, note that the maximum dosage is higher at 26 milligram. The reason for this higher maximum dose exception will be explained later. It is administered as modified release tablet or capsule and is administered between 2.5 to 6.5 milligram to 2.5 to 6.5 milligram 3 to 4 times daily. On the other hand, the buccal GTN is administered between 2 to 5 milligram 3 times a day. Alright, next, I'm sure that everyone would be curious on how this drug works to alleviate the chest pain. Let's take a look at how this drug treats stable angina. As mentioned just now, when the coronary arteries become increasingly blocked due to atherosclerosis, less oxygen is delivered to the cardiac myocytes. This results in chest pain, and this pain most often occurs when there is increased workload or or decreased oxygen supply. Nitrates increase the oxygen supply to the heart. They act to cause vasodilation, especially venodilation, which reduce the preload and reduce the oxygen demand, causing decrease in workload of the heart. Um, so nitroglycerin release nitrate ion, which is converted to nitric oxide by enzyme in the blood. Nitric oxide is a hydrophobic gas with a short half-life that then diffuses from the blood from the inside of the neighboring smooth muscle cell. Inside the smooth muscle cell, nitric oxide activates guanylyl cyclase enzyme, which then converts GTP, as you can see here, to cGMP, cyclic GMP. Cyclic GMP then activates the cyclic GMP dependent protein kinase, which phosphorylates myosin light chain kinase and also phosphorylated the circa pump. Phosphorylation inhibits MLCK so that phosphorylates the myosin light chain less. Less phosphorylation of light chain on myosin results in less myosin actin interaction and therefore smooth muscle relaxation. The circa pump is activated by cyclic GMP dependent protein kinase. This acts to decrease calcium in cytosol, also leading to relaxation. Alright, so nitrates, as mentioned just now, comes in various forms, but the most rapid acting forms are used to treat acute angina attacks. When given orally, nitrates have a heavy first pass effect and are largely destroyed by the liver before they even reach systemic circulation. Thus, for this reason, sublingual is the preferred route because they have a rapid onset of action. The sublingual GTN, either in the form of spray or tablet, is placed under the tongue, and then they are directly absorbed from the oral mucosa into the bloodstream. Two common sublingual forms, as I mentioned just now, includes the nitroglycerin tablet and spray. The sublingual GTN should be taken as soon as chest pain is felt. It can also be taken to prevent predictable episodes of acute attack of angina. Before taking the medication, patients should sit first because the medication could cause syncope due to vasodilation. Um, Guidelines indicate that three doses can be taken, separated by 5 minutes. Medical advice should be sought if the symptom persists more than 10 minutes after resting or not relieved by pre-GTN. The three total doses within a 15-minute period should not be exceeded, as this may cause hypotension and reflex tachycardia and may elicit a myocardial infarction or heart attack. On the other hand, the nitroglycerin ointment is used to prevent angina attacks and have an onset of 20 to 60 minutes. Nurses often apply this to the chest, abdomen, or upper arms. The correct dosing paper that comes with the medication should be used when applying the medication. Gloves must also be worn to prevent absorption to the skin. Once the ointment is applied, the ointment should be covered with an occlusive dressing like plastic wrap uh, before it is applied onto the skin. This essentially means that the ointment should not be applied directly using the glove, but as you can see here, it should be spread onto this dressing, and then using this dressing, the ointment should be uh, spread onto the desired site. So the ointment is applied in the morning and then 6 hours later. This provides for a 12-hour drug-free period at night, which is necessary to avoid tolerance to the nitroglycerin, which will render it much less effective. Remember to remove any residual ointment from the previous dose before applying the next dose. This can be done by gently cleaning with soap and water and then letting dry. For the pharmacokinetics of the GTN, the drug is rapidly absorbed from the oral mucosa. This is why the buccal and sublingual GTN are the drug of choice for acute angina. The GI tract and skin show well absorption too. The bioavailability after absorption is less than 100%. GTN is taken up by the red blood cell and smooth muscle cell of the blood vessel. It is widely distributed with a volume of distribution of approximately 3 liters per kilogram. The plasma protein binding is at 60%. This drug undergoes rapid metabolism in the liver by glutathione organic nitrate reductase to form di and mononitrate metabolites. It also undergoes hydrolysis in the plasma, and the drug is excreted as inactive metabolites in urine. The plasma half-life of glyceryl trinitrate is approximately 3 minutes, and the half-life of the dinitrate metabolite is approximately 30 to 60 minutes. Caution must be taken before administering the drugs for patients with hypothyroidism, hypothermia, malnutrition, recent MI, arterial hypoxemia due to severe anemia, hypoxemia or ventilation perfusion imbalance due to lung disease or ischemic heart failure, severe renal or hepatic impairment, as well as patient on pregnancy, lactation, and expecting pregnancy. Important contraindications include drug allergy, hypotension, severe anemia, closed-angle glaucoma, and elevated intracranial pressure, which occurs as cerebral vessels dilate and increase cerebral blood volume to further increase the intracranial pressure. The patient should never use PDE5 inhibitors used for erectile dysfunction concurrently with nitrate drugs, as they both increase cyclic GMP and could lead to a dangerous drop in blood pressure. The adverse drug reactions are related to vasodilation and include headache from cerebral vasodilation, flushing due to cutaneous vasodilation, orthostatic hypotension, which is low blood pressure when standing up from a recumbent position, and syncope, which is a medical term for fainting. It may also cause a degree of reflex tachycardia, which is a negative feedback response, in an attempt to increase the low blood pressure that was caused by the vasodilation. Okay, now let's talk about the drug-drug interactions. The hypotensive effect is enhanced with the use of vasodilators and other hypotensive drugs. The efficacy of oral and buccal GTN is reduced with drugs that cause dry mouth, such as tricyclic antidepressant and antimuscarinics. There is also an increased vasodilatory effect when GTN is taken with acetylcysteine. GTN may reduce the thrombolytic activity of alteplase. GTN also may increase the bioavailability of dihydroergotamine, which may lead to coronary vasoconstriction. Concomitant administration of PDE or phosphodiesterase 5 inhibitors with GTN is potentially fatal since this drug combination enhances the hypotensive effects. So the example of PDE5 inhibitors include sildenafil, tadalafil, and vardenafil. Um, the same effect is seen when when GTN is combined with ricequat. The same effect is also achieved when GTN is administered with other organic nitrates, that is also a nitric oxide donor.